Your eyes and your vision are under attack. Damaging blue light from the sun, your phone, your computer, your tablet, even light bulbs and car headlights is constantly bombarding you. The good news is our eyes actually already have a line of defense to counter the effects of blue light. This defense is made up of 3 pigments called carotenoids. MacuHealth with Micromicelle, the only supplement with the exclusive patent on all 3 macular carotenoids and Micromicelle technology.
The All Eyes Visual VRP is a portable vision testing platform that includes visual fields, acuity, color vision testing, pupillometry, and extraocular motility. The visual leverages virtual reality, artificial intelligence, and augmented technologies to enable eye care providers to test for and monitor common eye diseases. Visit alleyes.com for more information. With more screen usage and indoor time, myopia, also known as nearsightedness, is increasing and getting worse in children. Now, certified eye doctors can prescribe MiSight One Day, the first and only FDA-approved soft contact lens to slow myopia progression in age-appropriate children. Visit CooperVision.com to find a Brilliant Futures certified eye doctor near you. Do your patients know what presbyopia is?
There are people who are afraid of the press.
Have you talked to your patients about multifocal contact lenses?
I've heard the bifocal, but not multifocal.
Exactly, not multifocal.
Do you need help with your multifocal strategy? Learn more at the conclusion of this episode. Welcome back to part 2 of my interview with Dr. Marina Green. In this episode, Dr. Green explains the clinical health benefits of omega-3s. If you're new here and you like our interviews, press like, subscribe, share, and hit the bell. Also, please leave comments. Be sure to watch our full-length documentary, Open Your Eyes, on Amazon Prime, Apple TV, iTunes, Google Play, and YouTube Movies and Shows. And tune in to our brand new radio show, Saturday mornings at 9 a.m. Central Time on AM 1280 The Patriot. Let's talk about that again. If you could go into some detail about, let's go back to brain function. Give me some detail a little bit about brain function with the carotenoids together to help with the decrease in memory, Alzheimer's, and then we'll go to cardio-metabolic. So let's go a little bit detail on each one if we can.
Yeah, absolutely. So it actually started with different research done in carotenoids for the eye and understanding what was happening in the retina with these really extraordinary high concentrations of lutein, zeaxanthin, and mesiaxanthin in the macula. And then because the macula obviously is a neural tissue, then the researchers understood that there must be something happening in the brain. And then all this research started to occur in monkeys to understand what was happening in the brain in post-mortem samples to evaluate the concentrations. And then Professor Liz Johnson, in a big study in the US, not a big in terms of a sample size, but big in terms of the importance. They analyzed post-mortem brains of patients over 100 years old, and they mapped those samples with in vivo studies of their cognition. And what they found is patients with higher concentrations of carotenoids, lutein and zeaxanthin in the brain, had better performance in their cognition in their elderly period. And then from there, other studies started to show as well improvements of quality of life and working memory in elderly patients and in patients with Alzheimer's. Now, Alzheimer's is a very complicated disease, and having a cohort of Alzheimer's patients and following that cohort with an intervention is extremely complicated. So sample sizes of these studies are very limited, are small samples, which always causes a difficulty in analyzing the data. But what these studies have shown is that intervention with carotenoids, and in other studies, intervention with carotenoids with omegas improve working memory and improve the appreciation of these patients and their carers, that they are improving in their quality of life.
Now, I know there really doesn't seem to be any standard dose, but in your mind, this is something that you've thought about quite a bit. What do you think is a good preventative dose to take every day of omegas? And should you take it in a capsule? Would you take it in a liquid, or do you think it doesn't matter?
Yeah, that's, I think, the biggest discussion to have. How much and how. Like you said before, there's no evidence in terms of recommendations. There's no proper guidelines of how much do we need to take. But in my experience, I would be recommending a dosage above the gram. So we're talking here about between 1 to 2 grams of DHA and EPA. Now, other studies have also shown effects at dosages of 800 milligrams. So for example, in our center at the Nutrition Research Center, Ireland, with Professor Joan Nolan, they have conducted studies with smaller doses of the DHA and EPA, and they've proven effect.
And how about ratio to EPA to DHA? You like what's typically in nature, maybe a 2/3 ratio, or
correct?
What do you have a feeling on that?
Not really. There are studies that have used 1 gram of EPA and 1 gram of DHA, but there are also many studies that have kept the natural ratio of 2/3, so to DHA and EPA. I would stick to the natural ratio. I think our body needs more DHA than EPA. I know EPA is very important for the eye, and we support EPA for specific interventions, but I would stick to the natural ratio.
The natural ratio of 2/3.
Correct.
Okay. And so when we look at cardiometabolic disease, there's been a number of studies to show that people that take up to 4 grams actually of EPA alone decrease the risk of cardiovascular disease by about 25%. And there was one with EPA DHA, which was about, between 15 and about 20% decrease. And that was with EPA DHA, but that was with what we call in the United States ethyl ester form of EPA, or the prescription, the CEPA prescription, but that's not something that typically is used where you are. So correct. If you could talk about cardiometabolic disease and some of the studies and how you look at for primary prevention and secondary prevention, and even if there's not any great studies, what do you think is something that, sometimes we have to make decisions even if we don't have great randomized control studies?
Absolutely, I completely agree with you, Carrie, and I think that's part of my conclusion, and that I'd like to talk about at the end is exactly that. Science is important. It maps the way, but when we're talking about an individual, we have to understand at an individual level, instead of limiting the opportunity of using all these different interventions because it wasn't proven in X or Y study. First of all, we have to understand that the reason why we developed very strict high level of evidence studies in these so-called randomized clinical trials, and why we trust them so much was because of the pharmaceutical industry for the interventions of drugs. So for the implementation of specific drugs. That's the reason why they are conducted with such a strict logistics around sample size, adverse events, efficacy, etc. So the fact that we are measuring nutrition in an epidemiological study doesn't mean that it's any way less than a highly strict, high level of evidence randomized clinical trial. So that's what's happening. I think that's a very important comment that you made on the different studies. The fact that we are doing epidemiological studies by default makes it a lower level of evidence and makes it a bit harder to analyze and generalize the information. So what we've seen in these cardiometabolic diseases, I'm going to talk specifically about heart attack, stroke, atherosclerosis, and diabetes, coronary heart disease. There have been a lot of studies, and there's been a lot of analysis of the studies of the studies. And the conclusion in terms of guidelines and recommendations by the American Heart Association, for example, is for particularly secondary prevention. So we're talking about a person that already has a disease, for example, heart attack or heart failure, and the mortality and hospitalizations decrease in these patients when they are supplemented with omegas. Studies that are in diabetic patients or in patients with high risk to develop cardiovascular diseases, for example, a patient with high cardiovascular disease, with high risk of cardiovascular disease would mean somebody that has obesity, hypertension, and abnormal glucose, for example. So three important risk factors, and high cholesterol, that's the fourth one. Intervention or supplementation with omegas hasn't shown in this analysis of the studies. But if we look into particular studies, some, like you've said, like you mentioned, some studies have shown a very good reduction in the development of progression of the disease, or in morbidity, so the complications of the disease.
If I can just jump in here. So I just want to go over the study further. One is called the REDUCE-IT study, which was 4 grams of EPA in ethyl ester form, which is Vasipa, and that was versus mineral oil for 4.9 years. And it showed an outcome of ischemic events, including cardiovascular death, which was a 25% lower reduction in the EPA group, because that's EPA only. And then there was another study called the VITAL study, where they use Lavazza, which is EPA plus DHA, and they use 840 milligrams of EPA and DHA, and it reduced MIs or heart attacks by 28%, and reduced total coronary heart disease by 17%, especially in people who had were low fish participants and lower triglycerides by about 15%. So Vasipa, which is EPA only, is made by Amarin in US, which is prescription only, and it's about, if you don't have insurance, is about $400 a month. And the VITAL study, which is a combination of EPA and DHA, is the Lavazza product, which is also prescription, which is GSK, which also is around $400 a month if you don't have insurance. And those are both ethyl ester products. But we're also talking about triglyceride products, and that's something that's big in the United States. And triglyceride products, there are many studies that show that they're absorbed much better than the ethyl ester products, and that we could actually do better with the triglyceride products. You know, obviously these are big studies, and the big pharma has a lot of money to do these studies, where the companies that make the triglyceride products tend to be smaller, supplement companies, and don't have the funds to be able to do these randomized controlled trials. So I just wanted to interrupt for a second. And if you could continue with your point, I just wanted to make sure I got that right.
Yeah, thank you. Yeah, that's perfect. Thank you for commenting on that, Carrie. We need to be careful here on the studies that we're talking about. I suppose my angle is from a very safe place as a practitioner, from guidelines and recommendations, particularly from the American Heart Association. Now, from the public perspective, there are many small studies, like you said, that they're very valuable, that are properly conducted, that have shown excellent results on the intervention, the supplementation with omegas, and it seems like even doses just under the gram are good enough, and that's coming back to the conversation of our nutrition. And we have to look at the individual. If you have a person that has low diet, that has low concentration, will benefit more than somebody that already has a very good diet, for example.
Yeah, because Bill Harris showed that if you're using triglyceride, you could use less of a dose than if you're using ethyl ester. And if we could talk a little bit about dry eye, I know that you're an internist, and there's a lot of studies on dry eye and omega, and most of them show a benefit. But if you could explain a little bit about some of the research that you're interested in.
Sure. So I put in dry eye because I know you're very interested in dry eye, and you've talked about this before. So I let that third point for you. But the next 3 points are kind of trying to consolidate the previous slide on all the different health claims that they're out there. So one is about the kind of the core element is anti-inflammation. So there, for example, muscle recovery and strength has also to do with inflammation. So the muscle breaks and there's some sort of inflammation, and the omegas help in that recovery, which is a very not exactly, by no means not the same as what happens with rheumatoid arthritis, for example, as an autoimmune disease, but they do control inflammation. And then that will lead me to why are they important in terms of their mechanism of action in cardiometabolic diseases. And that's because they help in the process of inflammation, oxidative stress. They control that negative cycle that that otherwise will progress to structural damage and eventually the disease, which is, in all cases is irreversible.
And there has been some studies that show with omegas that they decrease inflammatory biomarkers such as C-reactive protein, IL-6.
Yeah.
And maybe you might comment on some of that, even some bone-related inflammatory markers.
Yeah, absolutely. And I think that the comment on the biomarkers fits perfectly well in this slide, which I'm trying to show that is a spectrum. So all these metabolic diseases, from degeneration, aging, and oxidative stress, are all related with the same common origin of oxidative stress and inflammation. And they share the initial steps of the pathophysiology, and more specifically, some of them can share the biomarkers, inflammatory biomarkers, and others will have specific biomarkers that will present, for example, in dementia or in cardiovascular disease. So there are different biomarkers. C-reactive protein, CRP, is one of them. Homocysteine is another molecule that has been shown, particularly for cardiovascular disease, that has a good prognosis in terms of outcome, a good evaluation of the outcome. And homocysteine can change as well with supplementation with omegas. Other interleukins related to inflammation, such as interleukin IL-1, IL-6 have also been shown that they're modified by omegas.
So omegas also decrease platelet aggregation, and bleeding time could be affected. Now, do we have to worry about side effects if we take omegas about bleeding?
Well, again, there are studies that you have the counterpart. So we were talking about the studies that have shown proper effects and benefits, but there are also studies that they haven't shown any benefits of omegas in primary prevention, which probably is where we are more interested at the moment. The idea is to obviously focus all our resources, research and economic resources in primary prevention. And they have shown some adverse events, but again, not enough to have a strong recommendation not to have supplementation with omegas. So no, my answer would be no. There's no need to be worried of some reported adverse events such as bleeding, because there's not enough evidence for that. Now again, that's where I want to get to. We have to understand that this is about the individual. So we're talking, if you tell me it's an elderly patient with high risk of brain hemorrhage that is already taking blood thinner medication, then probably the recommendation would be avoid them.
You know, because I know there was some studies that showed that omegas in people who had surgery had less deep vein thrombosis and pulmonary embolisms. And there was actually a study that showed that after open heart surgery, that there was less bleeding and less need for a transfusion. So it gets very complex, because on one hand, in the United States, if you go for surgery, they're going to tell you to stop everything, including the omegas. But on the other hand, there's been some studies to show that it's protective.
Exactly, yeah. And then there's other studies, for example, in terms of the adverse events that have shown that increases the risk of atrial fibrillation, for example. So I think we cannot focus on the adverse events in terms of the negative aspects of the omegas, because it's about particularly talking at an individual level. And like you said, there are small studies. The same as I wouldn't jump up and down with the other study that you mentioned of these fantastic benefits of reducing 25% of mortality. And you have kind of the very, very positive ones and the very, very negative ones that I think they kind of cancel each other out. And we're left with a very good evidence that supplementation with omegas is beneficial, particularly for specific conditions. For example, mental health, eye conditions, cognition, cardiovascular diseases.
I do have to ask you about the SELECT trial. If you're familiar with it, that it showed that in this trial that it increased the risk of prostate cancer. Now, there's been some people, the experts in the area have refuted it, and they felt it was because of the vitamin E, that they gave too much alpha tocopherol that blocked and depleted gamma tocopherol, and that it had to do more with something with that than it had to do with the omega in that paper by Bratsky. And I was wondering if you had a comment on that.
I wouldn't know about that particularly trial.
It's called the SELECT trial, so I just thought I'd bring it up. So
maybe I have. Sure, but that has more to do with kind of was a multi risk factor study on cardiovascular disease and lowering lipid lowering drugs, was it?
I believe so, yes. It was a very
Yeah.
complex, and that was just kind of a, like a red herring finding, I believe. But
Yeah, I think I know that study by the effects of the what they showed in terms of the outcomes of cardiovascular disease and the lipid lowering drugs. But the secondary analysis, I don't know if they did anything with omegas.
So, all right, I just thought I might bring them just in case you were familiar with it. The All Eyes Visual VRP is a portable vision testing platform that includes visual fields, acuity, color vision testing, pupillometry, and extraocular motility. The visual leverages virtual reality, artificial intelligence, and augmented technologies to enable eye care providers to test for and monitor common eye diseases. Visit alleyes.com for more information.
MacuHealth, your science-born and tested solutions for visual performance, macular degeneration, and dry eye syndrome. New products coming soon. Embrace the science.
So talk about some of about this slide that you have up right now.
Yeah, I think when we're talking about this controversy, omegas are in big controversy. Are they useful? Are they not? Are they ethically sourced? Are they not? I've talked about the nature of the studies, which are epidemiological, and that immediately by default puts a boundary for high quality of evidence, and hence they are treated in a different manner, more in a very strict. They go through a very strict scrutiny as if they were being evaluating a pharmaceutical new drug, for example. And hence why they can be considered low quality of evidence. And the point of this is that when they do these big analyses, which are called meta-analysis, and probably you're familiar with the Cochrane meta-analysis, because they're considered as low quality of evidence, they don't get to get into the proper analysis. They are put into a lower level and kind of a lower score. And hence we don't see this important recommendations to go ahead and supplement. And the point of the contradictory studies is because we're not analyzing the sample, the population. You mentioned in a study, I don't remember which one, but you said some studies showed better effect in patients with lower or higher concentrations of triglycerides. When you start analyzing your population like that, and you understand that this population has lower concentrations or lower intake of their diet, for example, a study you would be very familiar with would be the ARIDS. So ARIDS 2 showed in a secondary analysis that the intervention with lutein and zeaxanthin impacted on lower progression of the disease, particularly in patients with the lowest quintile in diet, which means that patients that don't have enough of their diet will be more likely to be benefited from supplementation. The other negative aspect of most of these studies is that there's no determination of blood of omega-3 levels in blood. So there appears to be, if we could link, patients are taking omegas concentration are rising in their blood, hence the benefits are A, B, and C. And we can control these studies in a better manner. And then finally, we have to also understand the omega-6 to omega-3 fatty acid ratio. And all of that leads us to understand the patient. We cannot give a generalized recommendation. Personalized prevention strategies and multi-domain intervention, which means that actually, I was meant to mention this study. There's just been a published study that used vitamin D, exercise, and omegas. And when you do multiple, a complex intervention like that, you have a better, a positive outcome in your intervention. So this study was able to show improvements in depression. So it's about not just looking at the one molecule, but about the intervention. Are we improving lifestyle? Are we improving exercise? Are we improving sleep patterns? And then many patients, for example, that have cardiovascular disease, potentially and very likely would have high cholesterol. Patients that are taking drugs to control their cholesterol have a lower bioavailability for omegas. So probably we're looking at a study that was giving supplements and they were not being absorbed properly by the participants. Because again, they're lipid molecules, they have more difficulty in getting absorbed, and hence they don't get into the blood and they don't do their benefits. And then you cannot see them in the study. So I think we have to dissect each study to a deeper level to understand that what's happening with the sample, what's happening with exactly the participants that are taking the supplementation. And then in these patients, not just recommend, of course, I would always recommend diet and improve lifestyle, not smoking. Smoking interferes with absorption of certain nutrients, but also in an important percentage of the population to include targeted nutrition with supplementation.
One of the tests that we do here sometimes is the omega-3 index test. Is that something that you're familiar with and that you have any experience with?
No, not really, Carrie. No, we don't do it here in Ireland. They started doing it in Mexico when I finished my when I graduated, but no, we don't have a clinical application so far. Is that in blood, obviously?
Yes, it's the amount of EPA and DHA in the red blood cells. And I believe it was developed around 2006 by Bill Harris and colleagues. And they found that if your omega-3 index is above 8 or above, your risk of having a heart attack or cardiovascular disease is much lower than if it's of the percentage of DHA and EPA in the red blood cells is less than, say, 4.
Interesting, very, very interesting. No, I hadn't, I didn't know what the ratio of EPA and DHA. I do know that it is important to measure the concentration of EPA and DHA in blood, particularly if we want to understand the different studies that can claim a benefit or lack of thereof.
Yeah, I mean, this test shows if it's less than 4%, your risk of mortality related to heart disease goes up quite a bit. And it's a test that could be done in the US at any of the standard labs. And I believe you could order it online from Omega Quant and do it yourself and send it in. But that's something that we have here in something that we do in the United States.
I think that's excellent in terms of your own evaluation of what's happening with you, and maybe you can understand how's your diet going. If your nutrition is not good enough, then you can supplement with omegas rather than particularly, for example, we eat seasonally. So usually summer would be the best month, but the best season, and then winter we don't have enough fruits, vegetables, and there's a lot of meat and other type of festives that parties and that don't allow for a proper diet. So that's when probably we can supplement, and that's what I saw in my study. We do most of our studies with carotenoids, and particularly we use MacuHealth that provides a high quality of lutein zeaxanthin and mesozeaxanthin. And we saw that most of our participants will change their diet depending on spring, summer, or winter, being the biggest difference in winter and summer. Now, and that one is a key to supplement, for example.
What kind of tests do you run for carotenoids? Are you running the skin test, hand scanner? by Pharmanex? Are you running any of the macular pigment tests? What kind of tests do you run? Do you do research on?
So we run three main tests, being the gold standard and the direct most important measurement with serum. So HPLC, high performance liquid chromatography, and that's done in a validated lab in the Nutrition Research Centre Ireland, the NRCI, run by John Nolan and Alfonso Cabrero. So that's kind of the highest quality of evidence for detecting carotenoids in human beings. The second one is detecting macular pigment. And we use the dual wavelength autofluorescence with the spectralis from Heidelberg to measure macular pigment in the retina. And then the third one that we use is a generic measurement of carotenoids. The skin scanner only measures every carotenoid, not just lutein zeaxanthin and isoxanthin. So that's the other technique that we use from Pharmanex. Yeah.
So that's the hand scanner that you use.
That's the hand scanner.
And the first one you use is serum.
Correct.
And how does the serum test correlate with Heidelberg?
It has a very good correlation, actually. We are talking about a medium correlation, which is higher than most of the studies have shown with other techniques, the subjective techniques, particularly flicker photometry. We're talking here about up to 0.4 to 0.5 of a correlation with serum and macular pigment with the Heidelberg spectralis. And obviously we have developed a proper technique to measure the macular pigment with the autofluorescence mode, and it is consistent throughout every single measurement.
I want to jump back to omega-3s and dry eye for a second, because there was a study that we have to talk about. I know people are going to watch this and they're going to say they didn't mention the DREAM study. And I'm not sure if you're familiar with that study, but basically it showed there was a big headlines with the DREAM study that omega-3s don't work for dry eyes, but they compared it against olive oil. And actually it showed that omega-3s and olive oil both help people with dry eyes, and that they both helped. It's just that the omega-3s, the olive oil was the control. It just then, I guess it wasn't statistically significant above the olive oil for the control, but it was a little bit better than the olive oil, but they both actually help dry eye. And I, being a scientist doing studies, and sometimes they make studies to fail. Was that a possibility? Is that a possibility?
Absolutely, yeah. And the fact that it fails doesn't mean that it's a bad thing. On the contrary, if you prove your null hypothesis is a good thing as well. And it's important to declare that you've found no effect.
And looking at macular degeneration, there's been a number of studies to show that omega-3s could decrease the risk of macular degeneration. Is that something that you have any information off the top of your head that you may want to comment on?
Yeah, absolutely. I think, again, back to ARIDS, the ARIDS study, the biggest study and most important study for AMD, they just published 2 years ago the ARIDS 3. So that is the follow-up of the participants that were in ARIDS 2, and they proved that the intervention with lutein and zeaxanthin on its own, and or the intervention with omegas and lutein and zeaxanthin reduce the progression of the disease and reduce the severity stages, the severe stages of the disease as well, with both the HA and EPA.
Yeah, and ARIDS had a report 30 that showed there was about a 30% less likely less likely chance of developing geographic atrophy or
geographic atrophy.
AMD, And then there was a meta-analysis by Chung in Archives of Ophthalmology in 2008, and it was a total of 9 studies, over 3,000 patients, to show that that omega-3s and fish intake decreased progression of macular degeneration by about 40%.
Yeah, absolutely. No, there is no doubt that the supplementation with lutein and zeaxanthin and mesozeaxanthin, and also the supplementation with omegas, are really beneficial for AMD in terms of progression of the disease, and also for severe stages of the disease, like atrophic geography, for example.
Right, and that 9 studies was a total sample of 88,000 people, but over 3,000 AMD cases. So it was a good study, and a meta-analysis to show that it was omega-3s was associated with a 38% or close to 40% reduction of AMD, and eating fish twice a week was associated with fatty fish that have that have the omega-3s was associated with a reduced risk of early and late AMD. And for yourself, a personal question: how much omega-3 do you take omega-3s? And if you don't take it, how much should you take? If you were going to take it, how much would you take?
Yeah, that's a very good question. And I'm very lucky, Kerry, that I live in Ireland and I have access to oily fish from local oily fish. So I try to have at least twice a week oily fish in my dinner, but also during certain periods of time, I do supplement with omegas. I make sure that the omega the label is clear enough that specifies that I'm taking both DHA and EPA. I take it for a period of 2 to 3 months, and then I kind of let my body rest for another 4 to 5 months, and then I take them again. Because the studies have shown that as much as we want, our diet is not enough. The lifestyle that we're living is not enough to achieve the concentration of the intake that we require, and not only for omegas, but for example carotenoids in our fruits and vegetables, and other compounds like vitamin D, for example.
And you do the 3 to 2 EPA to DHA. You following that ratio when you're taking supplement, or you're just taking more EPA or more DHA, or a little bit of both?
I think it depends on the quality of the supplementation. I very focus on that. Both are in. I think it depends, Carrie. Sometimes I can take the ratio, but sometimes I can take 1 gram of each, 1 gram of DHA and 1 gram of EPA. And
do you take liquid or do you take capsules? Do you think it matters?
Yeah, it does matter. Yeah, absolutely. Soft gels are by far the have better bioavailability. I can't say by far, but there are some studies that have shown different bioavailabilities, and it looks like soft gels are better for absorption.
And how about there's been some studies to show that omega-3s decrease premature births. How about for pregnant women with the developing brain? If you were pregnant, or somebody in your family was pregnant, what would you recommend they would take? As for, obviously we're not giving advice to the public. This is for our discussion. But if somebody in your family was pregnant, or your sister, if you had a sister or somebody in your family, a cousin or whatever, and they asked you, how much should I take as somebody that's pregnant, what would you recommend? If they didn't want to take fish because they were afraid of, say, the mercury levels.
Mercury contamination, yeah. So first of all, yes, pregnant women benefit from supplementation. Again, this has to be taken with a lot of precaution and awareness, because many medical associations and strict recommendations haven't been enough to prove or to recommend strictly that pregnant women should take omega supplementation, such as, for example, folic acid, that is a daily recommendation for pregnant women. Having said that, it has been shown that omegas, particularly DHA, is very important for brain development in the baby. So to what extent that I could recommend a ratio 2:3 or the dosage of the omegas, I wouldn't know, Carrie.
And do you have children, by the way?
No.
Okay. So I was going to say, if you had children, what would you recommend? Would you recommend children taking omega-3s?
Oh, that's a very complicated matter. I think I don't like children, and I don't like to talk about children. No, I think children are kind of very delicate. It's not my area of expertise at all, and I wouldn't like to mention kids because it's always very complicated, particularly nowadays. That again, the lifestyle. Our diet is not enough, and whatever we are eating, you know about the devolution theory, that it looks like even though you eat a bowl of salad, you are not eating the nutrients that you need from that salad. You probably need 5 salads to make it up for the nutrients that you actually need. So, and our kids are going through that same devolution of nutrients and nutrition and their diets. And then on top of that, you have all these influence from the food industry to consume processed foods and rapid, what are they called? Not rapid, fast foods, sorry.
Yes. Yeah. Now, how long if you're taking omega-3s, how long does it typically take before you think your blood levels will increase where you'll see a benefit, whether it's from dry eye or, for prevention of cardiovascular disease or decrease platelets like aspirin, or you may get for arthritis, you may have a little bit better feeling in your joints. How long do you think it takes for you to actually get a benefit when you start taking omega-3s?
In general, nutrients have a longer period to start doing their effects, or for you to see the effects. Even established drugs and therapeutics take a long time. So, for example, for cholesterol and diabetes, we're expecting a 6-month period for the drugs to do an effect, and that we see an impact on the patient's serum, for example. Particularly about nutrients, because it's a longer, kind of a more elaborate process. They need to be absorbed, they need to circulate, they need to be taken to wherever they need to go, the eyes or the brain. They need to be metabolized, and then they need to accumulate. So it is a longer process, and probably we're talking at least a 3 months period where you can start seeing some effects. And I'd like to push it over even to a 6-month period where you can actually see the benefits. If you are going to take a blood sample, you're going to probably see the effects or the increase in the concentrations in the first 4 weeks.
How about to store it? How do you store omega-3s? Because it could go rancid just like fish. How would you store it? I remember listening to a podcast, or before there were podcasts, a lecture by a doctor who was talking about omega-3s, and they were saying before you take omega-3s, if you're taking in a capsule, to smell it, and if it smells rancid, then obviously throw it out and not take it. Obviously if you're taking a liquid, but you say you like capsules better, but if you're taking a liquid, if it smells bad like rotten fish, obviously you're not going to take it. But to actually open it up with a pin just to smell it to make sure it's not rotten, do you recommend storing in the refrigerator or the freezer?
Sorry, Carrie, just very quickly there. Did you say I prefer tablets?
Well, here we have capsules.
Capsules, like soft gels.
Soft
with
gels.
liquid. But that is the liquid.
Yeah, liquid. Yeah, it's soft gels. Okay. I'm sorry. It's not a
no, sorry.
I meant to say soft gels.
No, that's fine. But soft gels are liquid, and when you have it immersed in a liquid, any lipidic substance, including carotenoids, for example, is easier to absorb. Just to have that clear there. Back to your question about storage, the normal recommendations keep it in a dark, fresh space, not hot, but furthermore than that, to put it in the fridge, I wouldn't, or in the freezer, I wouldn't know, Kerry. Is that something that you've heard, or people?
Typically here we recommend people put it in the refrigerator or the freezer, because we don't want it to, when it gets hot, we don't want it to spoil, just like putting fish on the counter where it could go, the oils could go bad. Here, parts of the United States, it gets very hot and it could spoil. So we usually recommend to leave it in the refrigerator. And some people recommend in the freezer, because if you leave it in the freezer, then you'll absorb it later in the digestive tract, more in the gut.
Interesting. I didn't know about that.
Yeah, and then with the soft gel to pinprick it, to smell it, to smell the liquid, to make sure it's not rancid. That's something that that typically that we'll do. But you prefer the soft gel, because a lot of people take the liquid. They get a thing of it and they take the liquid and take it that way. But that's not something you recommend.
No, I would recommend the soft gels, because you bypass the stomach, and then you let the omega spread into the intestine where they need to be absorbed. Whereas if they start being digested by the gastric acid, then you get less concentrations of the omega. So yeah, it is recommended that they are protected in a soft gel, that they are diluted in a liquid, like in the soft gel, and that improves the absorption of the substance, the oily substance, which can be carotenoids or omegas.
That's a great point, and that to wait for it to get in, and that's why some people freeze it, because it waits for it to get into the intestine to be absorbed.
Right.
So it takes longer for it to be absorbed. So what are you working on now? What are some of the projects that you're working on and studying at your lab?
We have very exciting projects at the moment. We've started 2 new PhD programs, and one of them is supplementing with carotenoids provided by Macu Health and omegas. So, and we're gonna see if they have any positive impact on athletics. So these are Olympic athletes in Singapore, and particularly in the shooting sport. So we want to see if we know that there has been a few studies done in shooting, because carotenoids improve precision and reaction time, and obviously contrasensitivity and all the different properties of visual function. So we're running a randomized clinical trial over 9 months in shooters and in the military as well. So within the military, the defense, the Department of Defense, the military that is in the shooting department.
Oh, excellent. And anything that you might be working on as far as disease?
Yes, that's a cross-sectional study. So we are partnering with the National Council for the Blind in Ireland to understand the prevalence of ocular diseases in elderly patients that are residing in nursing homes. So that's a very nice project in terms of a societal impact, because as we know, nursing homes are cannot provide the best medical care, and even less the ideal eye care. But particularly they're in a very complicated moment at the moment where the population is growing older, and they don't have enough resources, and potentially most of the residents have ocular pathologies that they are not aware of, that they can be prevented or corrected. And we want to implement certain strategies or policy changes to help, once we understand the different ocular pathologies, from cataract to posterior pathologies in the posterior segment, such as AMD, for example, or the common retinopathies, we can help in change policy for this population in Ireland.
Oh, fantastic. So I want to thank Dr. Green for joining me today, Dr. Marina Green. People want to find out more about you. How could they do that?
Well, I'm working at the Nutrition Research Centre Ireland, and my profile is also in the Southeast Technological University, and my LinkedIn as well.
Thank you. You're a wealth of knowledge, and I really appreciate you joining me today on the Open Your Eye podcast. Thank you very much.
Your eyes and your vision are under attack. Damaging blue light from the sun, your phone, your computer, your tablet, even light bulbs and car headlights is constantly bombarding you. The good news is our eyes actually already have a line of defense to counter the effects of blue light. This defense is made up of 3 pigments called carotenoids. MacuHealth with Micromicelle, the only supplement with the exclusive patent on all 3 macular carotenoids and Micromicelle technology.
The All Eyes Visual VRP is a portable vision testing platform that includes visual fields, acuity, color vision testing, pupillometry, and extraocular motility. The visual leverages virtual reality, artificial intelligence, and augmented technologies to enable eye care providers to test for and monitor common eye diseases. Visit alleyes.com for more information. Fitting multifocal contact lenses presents a big opportunity to meet patient needs while growing your practice. Alcon is your partner not only with our innovative portfolio, but through e-learning. Learn to enhance your multifocal strategy today with the Alcon Experience Academy.
OIE Broadcasting is the emerging leader in social media. We use scientific entertainment to drive more patients into your office. Visit oiebroadcasting.com and sign up today.
Since I bought Safe For You, my dad makes me clean his boat.
Es natural y es un buen producto.
Every time I go back to school, my mom always makes sure that I have my Safe For You products. I bring extra, and my roommates certainly don't mind.
It's a good thing I had Safe For You to clean up after this little guy.
When my hands get dry, I like to wash them with Safe For You.
And most importantly, the reason why I buy Safe For You is because it's safe for me and you.